Telehealth is the use of telephone, cell phone, computer, or any electronic gadget that will enable anyone as a patient to communicate with their physician as for the purpose of diagnosis, treatment, management, education, and follow-up care when a face-to-face consultation with a physician is not possible.
Good day to each and everyone. My name is Janelle Brian Biodulpa on behalf of group number 2 from grade 11 Science, Technology, Engineering, Mathematics, strand of Immaculate Conception Polytechnic, Santa Maria, Bulacan campus. I would like to extend a very warm welcome to everyone. We appreciate you taking time off your busy schedules to join us today. We hope that everyone will learn a lot today. We have lined up for you to be fruitful and engaging. At this moment, to introduce the objective of this meeting, a research on human disease project presented to the Faculty of Science, Technology, Engineering, and Mathematics, or STEM, of Immaculate Conception Polytechnic, in partial fulfillment of the requirements on general biology 2. And I also would like to mention Mr. Paulo S. Llanera, our instructor on general biology 2, the facilitator, and for giving us a chance to execute and to experience this project for those who inspired to be a medical practitioner someday. So to begin this meeting, we are pleased to have Dr. Japi Marquez, Doctor of Medicine from Ateneo School of Medicine and Public Health, on behalf of EVA Digital Clinic to deliver his opening remarks. Sir?
Hi, thank you very much for inviting me to talk about lymphatic filariasis. Like you said, I hope this is going to be fruitful, and I hope you guys get inspired to learn more about diseases, the human body, even rare diseases such as this. No, so yeah.
So thank you, sir, for that wonderful opening remarks. So, and for now, I would like to also call the presence of the members of our group. And listing starts with Pauline Nicole Aquino.
Dito po.
The next is Winter Bechaida.
Good morning po.
The next po is si Janolex B. Firon.
Good morning po.
Si Richmond Jasper Jewat, unfortunately, is not able to attend our meeting. For next is Charles Dexter Santos. So next po is si Ashley Rubia.
Morning po.
And for next is Mark Louis Vargas.
Good morning po.
And again, for the one who's unfortunately to attend this meeting, si John Renze M. Amagsila. And for last, our assistant leader, Sharina May Caballero.
Good morning po.
And of course, again, my name is Jonel Brian Biodulpa, the group leader. So personally, nagpapasalamat ako sa inyo for being here, cooperative on this task. So please maintain. I know mahirap yung situation natin. So before we move on, Doc, could you give us, ano lang po, parang kwentuhan lang naman po parang brief story lang po on how you take yung experience nyo as a doctor and how you surpassed college life, pre-med, internship, post-med, and if even nagtitake po kayo ng specialization po ninyo, no? So, motivation lang po sa amin, and of course, sa ibang students, na of course, di ba, marami pong takot mag-doktor ngayon because they are fear na, of course, kapag nag-doktor sila, automatic, they are the first line of defense sa country natin. They are the frontliners. Baga, maraming takot, especially sa mga frontliners ngayon na may vaccine. So, could you give us some motivation, sir?
Yeah, so medyo different yung story ko actually starting med school. I never really wanted to be a doctor. All throughout my high school life, I was really good in the maths and I thought I was going to be an engineer. Pero entering college, I still wasn't sure what I wanted to do. So I did what most of my friends did. They asked their parents, ano bang gagawin ko sa college? And then my parents said, you should take a health-related course para makalabas ka ng bansa. So I was like, okay, sige. I hindi naman yun yung intention ko. Like, I really just wanted to contribute in whatever way na kung saan ako magaling, di ba? Kasi gusto ko din naman maging excellent in the field that I chose. But yun yung advice ng parents ko. So I wrote it down sa college application ko. I wrote down physical therapy. Tapos, so, ang ginawa ko na lang, kasi madami namang colleges that I could apply in. So, dun sa mga health colleges like UP Manila, I applied for physical therapy. For UST, I also applied for physical therapy. Pero dun sa mga hindi health-oriented, like Ateneo or LaSalle, I applied for the engineering subjects. So, pinalad na pumasa sa lahat. Ang nangyari, yung mom ko, medyo weird yung story, but she said, kung ano yung matitipid natin sa tuition fee kung sa UP ka mag-aral, ibibigay ko sa'yo as allowance. So, na-excite naman ako. So, nag-PT ako. So, I studied PT. I realized that I loved anatomy. I loved physiology. I loved learning about how the body works. Parang, for me kasi, it's like peering into an entire new universe na that was inside me all along. Like, for example, when the first time I saw my red blood cells, I was sort of amazed kasi like these cells have been inside me the entire time, and I didn't know what they look like and how they function. And the more I learned about it, it really just was it was like falling in love. Like you learn more about it, and then parang it just becomes more and more fascinating. And even the knowledge that you gain, it becomes useful to you. So I decided to continue to do medicine. I went to Ateneo for medicine, like you said earlier, and then afterwards, yung lumabas na yung pandemic, I was confronted with a new well, everyone was confronted with enormous amounts of stress, pero like extra levels of stress for healthcare professionals. But for me, the way I approached it is I realized that in this time, I am so grateful that I understand the problem better than anyone else. Because like I'm not as although I'm stressed in the sense that I need to think of solutions to the problem. Um, I'm not I'm not anxious about it because I understand it a lot better than other people. So I know that it's a virus. I know how it spreads, and I know how to protect myself from it and my family members from it. And I understand, uh, yun, essentially how the disease happens. Tapos, so the other level of stress is how do we fight this problem? And like you said, a lot of us are stressed na parang, if I'm a frontliner, what if I get it, right? And I I personally relate to that because my family essentially forbid me from working in the hospitals, and that's why I had to think of how do I still carry out my profession without exposing myself too much, and at the same time protecting those who are working in the front line, working in the hospital. So I decided to start working as an online doctor. So that way, I encourage people to stay home and therefore not get exposed to the coronavirus or not expose other people to the virus if they themselves are infected, and still continue to help people understand their diseases. And a lot of people kasi they have diseases that they need to consult for other than coronavirus, and dahil ayaw nila lumabas, kailangan pa rin nila ng may makakausap na doktor, and through like this doing online consults, nakakatulong pa rin tayo sa kanila. Although hindi perfect ang online consults, kasi hindi ka pa rin makakagawa ng physical exam. Sometimes kailangan mo pa rin talaga mag-refer out of the service. Madami pa rin talaga natutulungan. I would say about 60% to 70% of our consults, we treat them satisfactorily through online consults. And then the rest, unfortunately, we still need to make adjustments, refer them to a physical clinic, refer them to a specialist, things like that. So, ayun lang yung story. So for people here who are interested into going into medicine, it is something I think that if you love learning, you will naturally fall in love with. But later on, when you start working, you're going to realize that you merong service orientedness na necessary. Otherwise, I have a lot of friends who finished medicine because they love the subject matter. But afterwards, they practice medicine in different ways. They went to corporate, they went to research. So essentially because they don't like the hospital work. But that's okay. When you do medicine, there are a lot of ways that you can contribute to health. So ayun, we don't all have to be in the hospitals to be good doctors. So ayun lang. If you're interested to go into medicine, give it a try. And something also I learned, no, it's also not a bad idea to go into medicine just to try it. And then if you don't like it, then quit, do something else. While you're young, it's an excellent time to really explore your options and find something that you love doing. Ayun lang.
Thank you po. Kasi for now, sa situation natin kasi, pag naging mainit yung topic about uh, yung mga pinapa-graduate na estudyante from medical school. So may mga nagsulong ding senators na for kumbaga parang right to para pasukin yung medical field, yung mga walang kakayahan. So I don't know lang po kasi sa amin, sa members namin, may mga gusto po talaga mag-doctor. But for now, I think hindi pa po siguro yung 100% sure kasi nga sa situation na meron tayo and yung quality ng education na meron sa ngayon. Kasi ako, personally, I want to be a doctor. But, no, pursue ako nung parents ko para pasukin yung doctor kasi we have relatives sa ibang bansa na pwede akong kuhanin. But, mas pinili kong it's either engineer or seaman.
Yung course sa college, personally, just do whatever you're interested in. Kasi ang med school naman, parang may classmates ako that finished accountancy, finished business, tapos nag-med school lang after. They had to take extra courses, pero dahil madali na lang naman yun, isang summer mo lang yun gagawin, and then you could get on your way na to medicine. So kung yun talaga yung gusto mo, na-realize mo dun sa college na parang, kunyari ngayon, high schools, naisip mo gusto mo engineering, sige, mag-engineering ka. And then later on, pag na-realize mo na gusto mo talaga siya, o de committed ka na sa engineering, pero kung ayaw mo siya, o de take a few extra courses, usually ano lang naman yun, biochem, some life sciences courses na extra. And then, yun, pwede ka pa rin naman tumuloy into medicine if you really want to. So, there are many paths towards medicine, no? And I think benefit pa ngayon na diverse yung background mo. Like, for example, if you have an engineering background entering medicine, that's going to be a challenge learning the medical subjects, but it's also going to be an edge for you after you finish medicine. Now, you're an engineer and you have a medical degree. There is a special place in the world for you to thrive kapag ganun.
So, thank you po, Doc. So, for now, let's move on. I would like to introduce our topic for today. So, napunta po sa aming topic is about make or find search for disease under lymphatic system. So, ang first na nakuha namin is about the casing disease. But upon researching, na-realize ko na hindi siya very common sa Pilipinas. Kumbaga, hindi gaano makaka-relate yung mga tao, if ever, na also informative naman, pero hindi siya ganun ka triggered na topic sa mga Pilipino. So, pinalitan ko po yung topic namin as lymphatic filariasis. So, although we have pre-knowledge about this disease, kumbaga, we would like also to speak for a professional doctor talaga na mayroon talagang kaalaman doon sa topic. So, of course, again, our topic for today is lymphatic filariasis under lymphatic system disorder or the disease. So, I would like to call the presence of our assistant leader for further instruction sa ating discussion for today.
So, thank you, Janelle. So, in this part, all of the members of the group will ask questions regarding to the topic lymphatic filariasis disease to the medical practitioner, Sir Japi, and everyone can join the discussion. So, the first one to ask the question will be myself. So, a pleasant morning to everyone. My name is Sharina May R. Caballero, a STEM 11 student, and I am the assistant leader of this group. So, here is my first question. Can you give us the basic description of the disease lymphatic filariasis?
Okay, sige. So yung lymphatic filariasis, ano siya? It's a mosquito-borne in parasitic infection. Tapos that results in, if untreated, can result in permanent disfigurement and disability because of the swelling of the affected body parts. So let's break that down. No? So I said it's mosquito-borne. So napapasa siya sa tao sa pamamagitan ng lamok. Tapos it's a parasitic infection. So yung filariasis, kaya siya tinawag na filariasis, it's a propagation of filaria in the body. So, filaria is a type of worm. There are three different species that cause lymphatic filariasis. Baka na-research na to. Yung Wuchereria bancrofti, Brugia malayi, and Brugia timori. But in the Philippines, it's only the Wuchereria bancrofti and the Brugia malayi species that cause disease. Tapos, so these worms, these filaria, they mature and they reproduce in the lymphatic system of the infected person. Tapos, if you're aware of how the lymphatic system is, para siyang kahalige ng circulatory system natin. No? So when there are blood vessels, usually there are lymph vessels that run parallel to it. And then there are lymph nodes at certain parts of the body, usually sa joint areas. No? So sa kilikili, sa groin, and then sa neck, madaming lymph nodes. Even inside the body, meron din lymph nodes at certain parts. And then yung lymph nodes na yun, yung purpose niya is to filter out impurities or essentially yun, dirt from the limbs. And part of nung nafi-filter niya out is the adult worms. So because nandun siya, bumabara yung worms dun sa lymph nodes, ang nangyayari, nagpo-pool yung lymph dun sa lymph vessels. Tapos dahil yung lymph vessels, they're not really supposed to accommodate a lot of volume, nasisira sila. So, ayun, because nasisira sila, nag-accumulate yung lymph in the parts na affected din sa mga lymph nodes na barado, and that results in the disease. No? So I'm sure yung nakikita din yung pictures when you look for filariasis online, yung mga patients namin with elephantiasis, yung may isang leg na sobrang maga, no? Parang kaya siya tinawag na elephantiasis kasi mukhang elephant leg yung leg nila. So yung nangyayari doon sa singit na area or sa groin area, nasisira yung lymph nodes, kaya naiipon yung water doon sa leg nila. And then sometimes kapag doon sa singit also, kunyari for males for example, nagkaroon ng problem, pwede din yung scrotum yung naiipunan ng lymph, no? So yun, nag-enlarge yung scrotum ng malaki. And then some people naman sa breast, some people sa arm, and then if it kung malasin ka, pwede din siyang sa kidneys mo bumara, and that will cause damage to your kidneys. No? So in general, ganun yung itsura ng patients with filariasis.
So thank you po, Doc, sa pagsagot. Ngayon po, mag-proceed na po tayo sa next question that will be given by Mr. Charles Dexter Santos.
Morning po. I'm Charles Cesar G. Santos. My question is, who's the most affected by this disease? Could you specify like the age or an age group, the gender, or a cultural group?
In terms of that question, who's most affected, it depends on where you are. So, kailangan kasi meron nung vector at kailangan meron nung parasite. No? So, parang yung other animals lang in the world or other creatures in the world, hindi siya distributed equally all over the world, no? All over the planet. So usually they're found in the tropical countries, so countries near the equator. But then may isa pang layer of filtering, no? So of the countries in the equator, there are countries that have already sort of eradicated the disease, no, through different public health policies and programs. So limited siya usually to tropical countries that are quite poor, no, like the Philippines, in India, Malaysia, Indonesia, countries in Latin America and the Caribbean. Tapos, so yan yung countries na affected. So other countries near the equator that have effectively eliminated the disease include countries like Egypt, Thailand, Cambodia. So ayun, in terms of age, the hypothesis is a lot of the infections nakukuha siya during childhood. Pero one important thing kasi about the disease is in order for you to get the chronic conditions like elephantiasis or the scrotal swelling, kailangan prolonged yung exposure mo. Kasi if you look at the life cycle of the filaria, so it reproduces in the human bodies, in the human, pero it needs to be in the mosquito para mag-mature. So kung kunyari bumisita ka lang sa parts ng Philippines na merong filariasis, makagat ka ng mosquito na may filaria, hindi nun automatically ibig sabihin na magkakaroon ka ng elephantiasis kasi tulad ng sinabi ko, kailangan repeated dahil yung mature mosquito na pwedeng yung mature na filaria na pwedeng mag-reproduce, kailangan kagatin ka muna ng mosquito madaming times para magkaroon ka ng sufficient na load nung infection. So ang nangyayari tuloy kahit nasa childhood siya nagsisimula, sa adults natin nakikita yung complications, no. So most of the patients, even the patients that I've seen with filariasis, hindi sila bata, no. Usually middle-aged na sila, in their 30s or in their 40s. Tapos male or female, walang pinipili since yung mosquito hindi naman pumipili ng kakagatin. I think the bigger determinant is if you live in an area with a lot of mosquitoes. Kasi yun nga, kung madaming mosquitoes, madaming chance na ma-infect ka nung filaria.
So, thank you po ulit, Doc and Mr. Santos. So, for the next question, it will be given by Ms. Pauline Nicole Aquino.
Good day po, Doc. I'm Pauline Nicole Aquino, and here's my question po. What are the symptoms of the disease and how the body is affected by the disease?
Okay, sige. So, good question. So, sa first instance, kunyari, normal, healthy adult, kunyari pumunta tayo sa areas in the Philippines with filaria. Kapag na-infect ka ng mosquito, usually wala kang mararamdaman. For most people, wala. Like, it's just a normal day. For some people, kapag meron ng enough na filaria to trigger an immune response, they will experience the effects of the immune response. No? So, inflammation in the area, pwedeng magka-fever, pwedeng magka-headache, pwedeng mabigat yung pakiramdam. And then in some people, kapag natatrap siya sa lungs acutely, pwedeng magkaroon ng cough. No? But then usually that's saglit lang yun, no? Nawawala siya mag-isa kapag natapos na yung immune response. But like I said, there's a chronic phase to the disease. No? Kunyari, repeatedly, madaming mosquito with filaria na nag-deposit ng filaria sa bloodstream mo and eventually sa lymph mo. Yun na yung nagkakaroon ng yung tulad na napag-usapan natin earlier na elephantiasis or yung swelling ng scrotum, swelling ng arms, swelling ng breast. So, ganun siya. And then, the body, usually, hindi naman to fatal. Walang, you will need a great amount of the filaria for it to block a major artery or major vessel to cause death. Pero yung pinakamalaking effect niya is the disfigurement. So merong effect sa body. Meron ding syempre effect on the mental health of the individual kasi lalo kung hindi na naiintindihan kung bakit siya nagkaganon. There is a greater propensity for depression for people with filariasis, not because naapektuhan yung utak nila, but because na-disfigure sila. So similar to other things that could happen to us if you, for example, get amputated. So that's often overlooked in patients with filariasis kasi ang naisip lang natin, paano ba natin paliliitin yung leg, paano ba natin gagamutin yung lagnat niya. Pero hindi natin frequently overlook paano ba natin ma-address yung self-esteem issues niya and yung mental health niya. Ayun. So that's how it affects a human.
So, thank you po ulit, Doc and Ms. Aquino. So, let's proceed to our next question that would likely to ask by Mr. Winter Bechaida.
Good morning, Doc. I'm Winter at Bechaida. My question po is there cure or treatments for the disease?
Okay, so this medyo okay. So for this question, there is a cure for the disease, especially if you catch it early. Merong mga effective na anti-parasitic medications. Usually single dose nga lang yan eh. Inumin mo lang isang tableta, and then that's enough na to kill all of the filaria in your body. Pero in the chronic stages, like I said, kapag nasira na yung lymph vessels mo and yung lymph nodes, there's no cure for that anymore. Depending on the site of the swelling, merong mga pwedeng gawin para ma-treat yung symptoms mo. Like, kunyari, sa leg, there are some surgeries na pwedeng gawin, although the long-term effects hindi clear kung beneficial. Kung sa scrotum siya, pwedeng i-drain lang or pwedeng i-surgery para isara yung area kung saan nag-leak out yung fluids. So, ayun. In general, yes, merong cure, pero if chronic na, medyo mahirap na siyang i-reverse.
So, thank you po ulit, Doc and Mr. Betchayda. Now, we will move to another question that will given by Miss Jenny Lexiron.
Good morning po, Doc. I'm Jenny Lexiron, and my question is, what causes the disease po and how can a person get it?
Yeah, so like we talked about earlier, the cause of the disease is the filaria. So there are three species of it: Bucuraria bancrofti, Brugia malai, and Brugia timori. And in order for it to be transmitted to an individual, kailangan siya makagat ng mosquito na nagkikarry ng filaria na yun. So the mosquitoes, there are different species also. So probably kilala ninyo yung Aedes, Culex, saka Anopheles kasi yun din yung nagkikarry ng dengue at saka malaria, di ba? So ayun, sila din yung nagkikarry ng filaria for filariasis.
So, thank you po ulit, Doc and Miss Ron. For the next question, it will gladly given by Mr. Renze Amagsila.
So, since wala po si Jen Renz, ako na lang po yung magtatanong ng questions niya. So, for his questions, how a person's daily life is affected by the disease?
So it depends on how severe the disease is and the affectation of the person. So for example, kung yung acute lang, nag-fever lang or namaga lang yung leg niya or the area na nakagat na temporarily, usually wala naman yung long-term effect on their daily life. But if nag-chronic na yun, meron na siyang elephantiasis, it usually, yung leg kasi, although the muscles aren't affected because it's heavier, because mas madaming fluids na trapped in the leg, nahihirapan sila gumalaw syempre. So it's hard to walk, it's hard to assume certain positions, like kneeling is hard for them, it's hard to sit. For some people, it's also difficult to sleep with a larger leg kasi when they try to elevate their leg, nagre-redistribute yung water dun sa other parts of their body and it causes some pain, some discomfort. So, ayun, naapektuhan most of their activities of daily living, including their sleep. And then the other part of how it affects the daily life is, like I said, the stigma. So a lot of people who don't understand how this disease is transmitted, how that this is a disease to begin with, they have preconceived notions na harmful for the patient. Like yung iba iniisip na sinumpa or kinulam or may ginawang masama kaya nagkaganon yung binte or nakakahawa na hindi pwedeng lapitan kasi mahahawa kayo dun sa tao. So may mga ganong stigma na nag-exist because hindi naiintindihan yung disease. So yeah, madaming ways na pwedeng ma-affect negatively yung daily life because of this disease.
Thank you po ulit, Doc. And we will move on to the next question that will asked by our next member, Mr. Mark Louis Vargas.
Good day, sir. Good day, group mates. I'm Mark Louis Vargas. My question is, during the pandemic, in this, we already recorded this disease, a consultation, or even on your physical clinic, sir?
Dun sa clinic namin mismo, wala pa kaming nakikitang case ng filariasis sa mabuting palad. I think madaming reasons kung bakit gano'n, no? Wala pa kami nakita. Una, probably hindi sila nagko-consult online kasi online ang clinic namin. Pwede rin naging effective yung measures ng DOH to sort of control this disease. No? So in 2018, nagkaroon ng program kasi yung DOH that aimed to end filariasis in the Philippines. No? So ginawa nila yung mass drug administration, similar to how other countries in the past defeated filariasis. So, ayun, probably yun yung reason. Pero before, nung before the pandemic, yes, may mga nakikita akong patients with filariasis. Sometimes in the clinical scenario, especially in public hospitals, madami tayo nakikita na ganyan. And also in my community immersion in Mindoro, medyo madami talagang cases of filariasis. Meron sila actually community there na ayun, na patients with filariasis, no, they're helping each other get through the system, sort of like a support group for each other. So, ayun. Hopefully, maging continuously effective yung measures ng DOH, and also apart kasi dun sa mass drug administration for filariasis, the measures as well to control mosquito populations for dengue also has a positive effect on controlling filariasis. No? So, feeling ko yun yung mga reasons kung bakit hindi natin sila masyadong nakita.
So, thank you po ulit, Doc and Mr. Vargas. So, for our last query for this morning, it would likely to ask by Miss Ashley Rubia.
Good day, Doc. I'm Ashley Rubia of St. Mark, and I would like to ask how important it is to take care or to give a significance, especially on our lymphatic system. In fact, that most of the Filipinos are unaware of this disease or
it is very, very important, no? Kasi, like I said, this disease, if you catch it early, it's curable. Like, kaya natin patayin lahat ng filaria. Tas, ayun din, pwede natin protektahan yung tao from the long-term effects of it, no? Just by a single dose of the medicine, or sometimes multiple doses kung mas madaming filaria in the body. But in general, ayun, it's something that we can prevent completely, and we can help people maintain their productivity and maintain their mental health as well. Tapos, it's important also, even if you don't get the disease, to know about the disease para alam mo na yung mga taong may elephantiasis ay kayang gamutin, hindi sila nakakahawa by themselves, and hindi natin sila dapat inaalipusta or tinatrato ng masama. So, ayun, importante na naiintindihan din natin, just in case may makita tayo na kaso, masabihan natin sila agad na, uy, may magagawa tayo para dyan habang maaga, gamutin na natin para hindi ka mahirapan moving forward na with your life. So, ayun. I think it's also important to understand this disease para mag-cooperate tayo with the public health programs that we have to fight the disease. Kasi hindi ka naman papayag na gawin yung policy or i-execute yung policy in your area kung hindi man naiintindihan na kayang-kaya natin tong gamutin at ayun, na madami tayong buhay na maliligtas or ma-maintain through the policy.
So, thank you po ulit, Doc and Ms. Rubia. After asking the question, Mr. Jonel Redulpa would likely to inform all of us about the clinic.
Yung tanong ko kanina po is about the health,
telehealth. Okay.
Can you give us?
So, yeah, telehealth, ano siya, it's a recently booming industry in the Philippines, no? So, it's essentially delivering healthcare services at a distance. Before, well, kwento ko lang, no, I've done some research on telehealth din kasi the earliest evidence of telehealth, parang smoke signals in Africa, like parang kunyari, nagka-outbreak dun sa tribe nila, magsusmoke signal sila para makita ng neighboring tribe na, hindi tayo pwede pumunta doon kasi may outbreak ng disease. And then, yung first ever phone call, kilala niyo ba yung nag-invent ng telephone? Naalala niyo ba kung sino? Si Alexander...
Bell, parang Bell.
Tama, si Alexander Graham Bell. So, siya yung nag-invent ng telephone. The very first phone call na ginawa niya, he called a friend kasi natapunan niya yung sarili niya ng acid, no? So, hindi niya alam yung gagawin. So, sort of telehealth yun, no? It's just now booming kasi a lot of people have more access to gadgets that can connect people together, like cell phones, computers, and then the internet is also much more stable, much more affordable then. So, ayun, mas nagagamit na natin siya. So, for us, our clinic, we are a primary care clinic. So, we handle general consults. So, as a primary care clinic, kami yung first touch. No? So, all patients na may concerns, na kahit ano, sa amin muna. And then kami, kung kaya na namin i-treat by ourselves, to-treat na namin, i-diagnose na namin. Pero kung kailangan ng specialist, i-refer namin to a specialist. No? So parang ganun yung setup niya. But like I said earlier, hindi pa perfect ang telehealth kasi madami pa kami hindi nagagawa online. No? So hindi namin mapapakinggan yung heart, hindi namin mapapakinggan yung chest, hindi namin mapapress yung tummy. But madami na din kasi nag-evolve na gadgets. No? So there are parang may mga transmitters na ng sound na parang yung patient pwede mo siyang i-instruct saan i-didikit sa chest and then maririnig namin yung heartbeats and then we can interpret the sounds for them. Hindi pa siya widely pervasive. I don't think it's even sold yet in the market. It's still being tested and researched. Pero I think in the future medyo ganun na, no? So everybody just has their own doctor that they call. Tapos ayun, yung doctor nila may papagamit na device, pwedeng ipagamit yung smartwatch na parang ilan yung heartbeat mo, ilan yung oxygen mo, ganyan. So ayun, yun yung future. Pero right now, mostly usap-usap lang over the internet, no? So the shortest na ang alam ko, may program sa Lasal das Marinas saka sa UP College of Medicine na medyo accelerated siya. So in 6 or 7 years, pwede ka nang mag-finish with a medical degree. Pero wala kang bachelor's degree. Meron silang, meron pala. May bachelor's degree sila, parang integrated medical subjects, parang ganon. But for some people like me, pinili kong mag-pre-med na course. Yung pinili ko ay physical therapy. So nung panahon ko, 5 years yon, pero right now 4 years na lang siya. There are other pre-med courses like psychology, biology, any of the allied health courses, pwede din siyang pre-med like nursing, occupational therapy, speech pathology, public health, medtech, pwede yan lahat pang pre-med. And then there are other people na totally unrelated to medicine. Like like I said, may classmates ako na nag-accounting, nag-business, may engineers then that I know na nag-med school after. Pero it depends on the med school that you're going to go into after, kung ano yung courses na i-require nila sa inyo. Usually, parang may 3 units of biology or 3 units of biochem na kailangan i-take. Usually, dahil yun nga lang siya, 3 units, natatapos siya ng isang summer. So, kayang-kaya naman siya habulin. So, essentially, kahit anong course pwede mong gamitin to enter medical school. And then, after you do your pre-med, you need to take the NMAT or the National Medical Admissions Test. So, it's a nationwide exam. Tapos, basics lang naman yung tinatanong, like basic biology, basic math, tapos may logic din, and abstract thinking na questions. Tapos, i-rank kayo yon. So, national exam kasi siya. So, you get a percentile rank. So, for example, if your score is 99 plus, the scores you got is higher than 99% of the population. No? So, you need to prepare for that. And then, pero personally, I think the preparation for NMAT, it starts in around high school. So, kasi yung mga lumalabas na questions sa NMAT, sobrang basic na talaga, like high school level math, high school level science. It's really just a matter of na-retain mo ba yung inaral mo before, naalala mo ba yun. Pwede naman mag-review, mura lang din naman yun. Tapos, ayun, after the NMAT, you apply na for the different medical schools that you want. So, yung different lang, for example, so you can decide, when deciding for a medical school, what you need to look for is their curriculum. So merong 2 different types of curricula in the Philippines. No? So merong modular and then merong traditional. So yung modular, yung schools like UP and Ateneo, they go through the different organ systems one by one and then study them by system. So kaya siya modules yung tinatawag. And then there's traditional na ang pag-study mo ay by subject like biochem, anatomy, ganyan. So by subject matter siya in general yung pag-study. So may pros and cons yung each teaching learning methods. I preferred the modular one kasi mas maiksi yung attention span ko. So, pinili ko yung modular ng sa Ateneo. And then the other consideration when picking a medical school is if well, yung sa Ateneo, nag-iisa lang siya ngayon na may additional degree. So after you finish the MD, you also graduate with an MBA. So the reason is not because kailangan kumita ng pera from medicine. No? It's because when you look at most of the innovations in the world today that have made a difference on humanity, in-apply siya in the business model. Like for example, Wi-Fi or the internet, hindi naman siya pinamigay lang ng ganun, di ba? Parang may business model that's behind it. Kaya lumaganap siya and it was able to change the world. So medyo ganun yung principle behind the MBA for Ateneo. Not because we want to make money, but because we want to be effective in changing the world. So, ayun. And then the last thing you need to take into consideration when looking at schools is their performance in the board exams. Kasi hindi ka pwedeng mag-practice ng medicine kung hindi ka pumasa ng board exams. And part of it, part of preparation for the board exams is how you're taught in medical school. Kung ginagamit ba yung teaching learning method na swak sa style mo, and if effective ba yung school in general, lalo kung in-house yung internship nila. No? So, the good schools, madami naman, all across the Philippines, madaming well-performing in the boards. Pero ayun lang, check nyo muna bago kayo mag-apply, ano ba yung performance ng school na to sa boards. Kasi may mga schools, lalo yung mga maliliit, na mura yung tuition fee, mababa yung entry requirements, pero hindi sila nakakapasa sa boards. So, inaksaya mo essentially yung 5 years mo sa kanila. So, wag natin yung pipiliin. Okay? Yun lang. And then after medical school, pwede kang mag-residency. So residency is sort of yung first step in specialization. So yung mga residency programs yan yung mga pediatrics, internal medicine, surgery, obstetrics and gynecology. So kung may napupusuan ka doon, pwede kang mag-specialize. So that's going to take another 3 to 6 years depending on the program that you enter. Sa hospital ka na nun mag-a-apply. So as a resident, kumikita ka na nun ng pera. So medyo independent ka na nun. Pero as a med student, sobrang hindi. Very independent. And then the reality is here in the Philippines, para maging independent ka as a resident, you need to do your residency in a public hospital. Kasi sa private hospitals, maliit yung sweldo. Like less than 20,000 a month. So hindi ka makakabayad ng rent for yourself. Hindi ka makakabayad ng food. So ayun, a lot of my friends who yung mga galing sa province, nagpunta sa Manila, tapos nag-start na ng life nila, sa public hospital sila nag-residency para, ayun, nakakaipon na sila, natutustusan na nila yung sarili nila. Yung iba, dahil magaling mag-budget, nakakapagpadala din ng allowance sa parents. So, ayun, magandang bagay. Pwede naman na mabuhay after med school. And then, tulad ng sinabi ni Jonelle kanina, there's an option to go abroad. Madaming countries na nire-respect na ang graduates from the Philippines, katulad ng US, ng UK, at ng Australia. Meron lang tayong kailangan i-take na extra exams para maging registered tayo as doctors in those countries. Pero if that's what you want, go for it. No, parang it's your right to pursue your dreams and to pursue a better life for yourself and your family. So, ayun lang. It's noble to stay here in the Philippines and work for Filipinos, but that's not what you're put on this earth for. You're put on this earth to enjoy life for yourself. So whatever that means for you, if that is through serving the Filipinos, then excellent. But if that's pursuing a life somewhere else, that's also perfectly valid. No? So ano pa ba? May questions pa ba kayo about the med school life or kung paano siya? Med school is very competitive. There are med schools like Ateneo that's trying to make medical education more community-based, no? Na parang hindi mo na-feel na mas matalino yung isang tao kasi parang everyone really works together to make med school happy. So there are schools like that. Usually the newer ones, no, like yun nga, Ateneo and Angeles, I think is also like that. Ayun. But ayun lang. Yun lang yung ma-impart ko from my personal experience. Kung may questions kayo, I'll be happy to answer them.
Thank you po. So, Yun na po yung last na questions na pwede namin matanong since pa-end na rin po. So for this moment, I would like to give also uh, thank thanks being grateful po sa inyo, Dr. Japi Marquez. Of course, the EVA Digital Clinic for giving us opportunity as a student to do this meeting. So thank you very much, Sir Japi Marquez, and also in behalf of EVA Digital Clinic. So uh, is there any last words po sa inyo, Dr. Japi, before we
Yeah.
end this meeting?
So, last words. Words that I wish I heard in high school was that really follow your dream. Right now, I'm sure you guys have dreams. Pero ako before I had dreams but I wasn't sure. So really just spend time to think about what you want to do with your life because it's going to be a crossroads yung entering college na eh. Kasi you're going to start picking your where you're going to start as a profession. But also, don't take college too seriously kasi there's always an opportunity to change careers. No? There's always an opportunity to change a direction. So, ayun lang. And if you have any questions, I think I gave our assistant my email to send to Jonel. No? So, tingin niyo na lang din sa kanya kung may questions kayo about med school or if you need help with anything else, email niyo na lang ako and I'll see what I can do to help you.
Thank you po, sir. So, for the last closing remarks, so I hope that, again, thank you very much po for your active participants sa lahat overall for the active participation sa meeting na to sa mga members of our group. And I hope you enjoy the seminar. Ga, ano lang, usapan lang, like, not very serious talking kasi it's a consultation. Baga, it's a serious topic we're tackling about. So, again, thank you so much po, Sir Javi Marquez, in behalf of group number 2, from grade 11 STEM St. Mark of Immaculate Conception Polytechnic. So, yeah, so far, again, I would like also to call the presence of the members of our group. And listing starts with Pauline Nicole Aquino.
Thank you po, sir.
So si Winter Bichayda.
Thank you po, sir, for a informative infos that you give to us.
So the next is nag-lead na po si Janelex Ceron, si Richmond Jasper Juat, and next si Charles Dexter Santos.
Thank you po sa dagdag kaalaman po.
Si Ashley Rubia.
Thank you po, sir, sa mga information na binigay niyo.
And last is si Mark Louis Vargas.
Thank you for your time po, sir.
So again, in behalf of our school, Immaculate Conception Polytechnic, under Science, Technology, Engineering, and Mathematics, grade 11, St. Mark. So maraming salamat po, Sir Dr. Japi Marquez.
Okay, salamat din. Stay healthy. Stay home.